Stream Team, welcome back for a special episode of Q&A. We have some of the sauciest and spiciest questions that have been asked on social media. And so, Kat, I thought we'd just dive right in here and see what we got.
Ooh, saucy.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. All right, so this
Are you going first?
Yeah, I'm going to go first.
He's
This is for you to answer. How often should married couples have sex? We went from daily to maybe once a week, and I'm worried we're broken. What would you say to Miss Broken?
I feel that this is a loaded question that you wrote. I feel that I am really getting railroaded here.
No, listen,
But
sweetheart.
on the event, you did not write this question.
I did not. If I did,
Okay.
it would be like, how come it's not twice a day? No,
Okay,
that
yeah.
sounds awesome.
How often is reasonable? I mean, 3 times a week, 4 times a week, and he's doing a no. I think you have to take into account scheduling. Sometimes things go long, days are long, people are tired. I think that as a general rule, you should shoot for at least, twice.
Well, hold on.
To keep some consistency.
Let's go back. Let's go back here. Let's answer her concern. She's worried she's broken, that their marriage is broken. Is their marriage broken because they went from sex from daily to once a week?
Absolutely not. Absolutely not. I think this happens over time. I mean, when you're dating and things are really woo-woo, things happen often. Life comes and gets in the way, and it's okay. It's okay. I mean, the fact, honestly, I hear more from women especially. Once a week sounds okay. I hear from a lot of women weeks and months and nothing's going on. But I think that is more common than people would like to confess or realize. So once a week, no, she's certainly not broken. Not by any chance.
May I chime in?
You can.
Okay.
I'm afraid.
No, I think the key thing here for the audience to hear is that the issue is misalignment. And so
Sure.
You've got to make sure you're communicating with your partner like we've talked about in a previous episode. And if you're both happy with once a week, that's okay. Now, certainly we want people to be physically intimate because it's often a sign of overall health. It's a way to keep everybody happy. And so I think that's the key, is not the decrease in the frequency, but making sure you're both okay with it, and or that there aren't bigger root causes leading to this.
Yeah.
So,
See, you answered the question better than I did.
there you go. Well,
asked me.
I'm the doctor. Go ahead and ask me a question.
Okay. All right. Here's my question. Is it normal for my wife to have zero sex drive after having kids? It's been 2 years and I'm worried something's medically wrong. It's a good question.
So, this is a great question. So libido, as we've learned from previous episodes, has a number of different factors that play a role, both from situational to actual medical. So I think we've got to move away from the term of what's normal. We don't care about normal. We care about what matters to you. And I'm guessing, based on this question, that it's obviously bothering the partner that, hey, we used to have it and now it's not really happening. So again, I think this goes back to the first question we received. You got to go back and communicate. Talk to your partner and see what is going on. She just may be completely overwhelmed and not at all bothered by this. She may think you're a jerk because you go off and play golf every weekend with your buddies and, she's stuck with the kids again.
But isn't it possible?
Or she may be equally bothered and wants to get medical help, but doesn't think she can find somebody, doesn't have permission, and just wants you to acknowledge it. So there's so many different factors. It's such a complex situation that you can't unpack based on the details. But listen, if it's causing you bother, it is not normal, and you should absolutely seek medical attention. But first, just start with talking to each other, because you may actually diagnose and treat the problem yourself.
And I guess after having kids, hormonal changes. I
Absolutely.
mean, she could be feeling completely differently medically.
100%. And that's where it comes down to how much it's bothering her. But first starting with asking, hey, honey, what's going on?
Gotcha.
All right. Question looks like from could be from either party. Is it normal to lose attraction to your spouse when they let their health go? I feel guilty, but I'm not attracted to my wife since she stopped taking care of herself. How would you respond to this guy, Kat?
Ooh, I have really gotten, these are tough to answer because I feel like the honest answer is I think that could happen.
Yeah.
I mean, honestly, if your partner really lets themselves go, and maybe you haven't, maybe you're working hard, could that affect your attraction to them? Yeah, for sure.
Yeah, I mean, I think anyone can resonate with the idea of course, you've got that love for your partner and you've been together, if you've had
Of
children,
course.
all of it. So we're not talking about love, but physical attractiveness can change. And especially I could see there being a resentment if you've put in the work to really keep up your at least where you started, right? I mean, I think it's more about the change more than anything.
Sure.
Listen, there's a lid for every pot, as they say, and
Of
some people
course.
find different things attractive. But if you fell in love with one person and now they look definitively different, I think that's very reasonable to feel that way. This is a tough one though to broach and
Tread
hey
carefully,
honey,
tread
we need
lightly.
to talk. So I actually had a patient come to me and say this. He was having some sexual dysfunction and he's like, I got to be honest, I'm just not attracted to my wife much anymore. And I mean, that's a tough one because that's not anything medical on his end. So, I don't know if I've got a great answer for that or any guy does, but I think if it's something that's bothering you and it's ultimately going to impact your relationship, you've got to come up with some way to talk about it and try and, this is why we talk about promoting health as couples, right? Because I think if you start doing these activities together, it makes it a lot easier for that other person.
Absolutely.
So, all right, Kat, what you got?
Okay, I'm next. My husband refuses to go to the doctor for his erectile dysfunction. He says it's just stress, but it's affecting our marriage. How do I help?
Yeah,
It's a
this is
good one.
this is a great one, and guys, let me stress this beyond anything else. If you hear nothing else today, erectile dysfunction is the canary in the coal mine for your health. When the blood vessels to the penis start getting constricted, it's the earliest sign of atherosclerosis, which is hardening of arteries. That should sound familiar because it's the
Yikes.
same process that leads to heart attacks and strokes. So we can all giggle offline about haha ED, Viagra, little blue pill. This is serious medical stuff in most cases. Now, it could be stress, but that's a diagnosis of exclusion, meaning you go and have a full medical examination and we make sure it's not something more serious. So, her question is, what can I do to help? Well, if the encouragement hasn't helped and the trying to schedule a doctor's office helps, I imagine she has some pretty persuasive ways of motivating her husband that she could probably come up with.
Well, or framing it just like you said,
Yeah,
this is a potentially a medically concerning issue,
absolutely. I mean, listen,
indicative
honey,
of other
honey, I'm
things.
worried about you. I've listened to episode of Balls Deep with Dr. Pazona and Kat. This sounds like it could be serious. Like, I think that's, showing that it goes beyond this and that also we have to get out of the stigma that ED is this taboo thing we can't talk about. 50% of men by age 50 have some form of ED. You're not alone.
And it's not weird.
No, just go get checked out. So,
Okay.
all right. Last one for my end. So, my spouse is on antidepressants and it's affecting our sex life. Should we talk to the doctor together or is that crossing boundaries? What are your thoughts on that? Is this something you want to be part of in terms of a conversation?
I mean, yes. Why would you not talk about that together? As a person who doesn't mind sharing that I have struggled with some depression in the past, I'm still amazed that people don't want to talk about this. They're very embarrassed to talk about it. They're embarrassed to talk about taking antidepressants. This is really something a lot of people are dealing with. And the person you would especially want to discuss this with and have a very open conversation about is your partner, your spouse. I think not talking about that with a physician together would be a real mistake.
Yeah, I think it depends on the couple and the person. The most important thing is that
you talk about it.
Someone addresses it with the physician,
talks about
because antidepressants, especially things like Prozac, Zoloft, Paxil, they're called the SSRIs. We talked about using them for delaying ejaculation, for premature ejaculation. Well, that can cause a lot of sexual dysfunction in both men and women when you can't orgasm, and that's a big problem. And so there are alternatives. And so speaking up to your healthcare professional is always the right answer. Whether or not you pull your partner into that medical visit, I think it really depends.
It's up to you.
Yeah,
and your comfort
absolutely.
level.
That's not, I don't need to have a person's spouse sitting across from me to practice urology. And, a psychiatrist, that's certainly a very intimate relationship, and I don't want to speak for my colleagues, but, I think it's something that needs to be brought up regardless.
I would agree wholeheartedly with that. And the last question is mine. My husband has premature ejaculation and won't talk to a urologist about it. It's affecting our intimacy, and he just avoids sex now. How do we fix this?
I want to first start with saying the last question is mine. And to be clear, I am not the man in that question there.
No. Okay.
You phrased that in a way where I'm like, oh,
sorry. I dial it back.
Is there something I need to know about?
Oh, please. I dial it back. It's a very good question, though.
No, absolutely. This is same conversation with the erectile dysfunction with premature ejaculation, with the one caveat that PE or premature ejaculation is rarely a sign of a more serious medical condition.
So that's not the same as the potential heart issues.
So there's rarely something, quote, bad going on underneath. But again, sexual health equals health. If this is causing a bother and a lot of stress, we have a lot of really great treatments that are out there that are safe, easy to use for premature ejaculation. And this should get addressed. I mean, you shouldn't suffer in silence in the bedroom. One of the beautiful things of an adult, mature relationship is sharing that physical intimacy. It's what changes it from any other sort of relationship you might have. And so to let that aspect of your relationship really fall to the wayside because of embarrassment really is a shame. This is what I do all day. We treat people with empathy. There's ways to very easily treat this in a discreet way. You're not walking into our, waiting room with a giant sign on your head that says, "Hi, I have PE or ED."
No.
We treat people with kindness, with respect. And so please go get help. There's easy treatments. Stop letting your sex life suffer.
Good advice.
Well, thanks, Catherine. This was great and fun as always. So, Stream Team, listen, we want to hear from you. These were some great questions from previous audience members. How would you answer these? There's no right answer to a lot of these questions. I especially want to hear about the one about how you'd answer about the letting their health go or not attracted to your partner. I'd love to see what some
and
of our
I
listeners...
want to know how many times you guys think we should be doing it.
Yeah, there you go. Yeah.
I mean, that's what I want to know.
Once to twice a day minimum. So,
wow.
Stream Team, thanks for joining us today. Please show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Thanks, and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream Team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.